Today. Friendly reminder, this platform is only for members of the press. If you're a member of the public, please watch the live stream on the SF.gov TV YouTube channel. Please keep yourself on mute and turn off your video feed. Members of the press, please submit your questions through the chat box to DEM Press Q&A. Please type your name, news outlet, and question exactly as you would like it to be read. Please also indicate if you need a response in Chinese or in Spanish. Each outlet is allowed to submit a maximum of 2 questions. If you submit more than 2 questions, we will ask you to prioritize which 2 questions you wish to ask. Speakers will be limited to answering questions about the health ordinance. We will begin addressing questions after the last speaker's remarks. Please submit your questions prior to the end of the last speaker's remarks. The order of speakers today is Dr. Jeannie Lee, followed by Dr. Catherine James. And with that, I'd like to turn it over to Dr. Jeannie Lee. Thank you.
Hi, I'm Jeannie Lee. I'm a pediatrician with the San Francisco Department of Public Health, working on the school guidance. Just to give some background, schools are still closed according to the San Francisco health orders. And we're sharing this preliminary guidance because we know schools need to plan ahead for safely resuming in-person attendance if and when San Francisco health officer allows schools to open. The good news is that we have learned a tremendous amount in the last few months about COVID-19, both about how it affects children and teens and about how it's transmitted and what's effective in preventing spread of COVID-19. We know that the risk of serious COVID-19 illness is very low for school-age students. And also evidence indicates that children, especially those under 10, are less likely to be infected with COVID-19 and probably less likely to transmit it. The risk increases with age, so for high school students, they are probably closer to adults in that risk, and middle school students are somewhere in between. In addition, we know what's been working well to prevent COVID-19 spread in our child cares and summer camps, both locally and nationally. And so the principles in the school guidance are very similar to what we've been successfully using in those settings. The public health guidance was drawn from the best science available to us at this time. It will continue to evolve as we learn more about COVID-19 as well as how it affects children and adolescents. So you can consider it an iterative process, this guidance. It was developed by the San Francisco Department of Public Health with extensive input from SFUSD, the Catholic schools, and the independent private schools in San Francisco. It's informed by guidelines from a variety of sources, including the Centers for Disease Control, California Department of Public Health. We also refer to guidance from Harvard School of Public Health and the American Academy of Pediatrics. We hope that schools will be able to use the guidance as a tool to apply the public health principles in their operational decisions around reopening. It's designed so schools can coordinate and layer various age-appropriate, site-specific interventions to protect their students, staff, and families. A quick overview of some things we've included in the guidance. We emphasize preventing transmission of COVID-19 via respiratory droplets, especially transmission between adults, which we know is a greater risk, using physical distancing, universal face coverings, and other interventions, and generally feel that this is more important than frequent cleaning and disinfection. And that's because coronavirus is relatively easy to kill. Most disinfectants are effective, and frequent hand washing breaks the spread of transmission. We recommend that student cohorts be as small as possible, but no larger than standard classroom size in elementary schools. Cohorts can be larger than a classroom size in middle schools and high schools. We also recommend staggered schedules in schools to prevent the mixing of cohorts, for example, in hallways, at lunchtime, at arrival, and dismissal. Finally, these guidelines are about how to keep teachers, staff, and students as safe as possible in schools, but safely reopening schools needs to be a community effort. Even though children's risk is lower than adults, children do get COVID-19 and they do give it to others. So families have a big part to play in taking precautions at home and in keeping the school community safe. because the most common way children get infected with COVID-19 is from an adult in their home. As a community, we all have a responsibility to minimize gatherings, wear face coverings consistently, wash our hands frequently, and practice social distancing, as well as staying home and away from other people when we're ill. Students can do their part with their stable cohorts, physical distancing, universal face coverings, and maximizing the use of outdoor space. But if COVID-19 spreads too rapidly in our city, that may not be enough for them to be able to open safely. We all have a huge debt of gratitude to all of the teachers and school staff for serving on the front lines, and we owe it to them to do our part, to do everything we can to keep students, teachers, and staff as safe as possible in the schools. So I think this is where I open it up for questions.
Thank you, Dr. Lee. So at this point, we will start receiving questions via our Zoom chat. Please submit all your questions to the DEM Press Q&A host. And then our colleague here, Cassidy Wallerstein, will ask the questions to Dr. Lee. We also today have Dr. Feng here to help answer any questions in Chinese, and also Dr. James will join us at 2 p.m. We're just in the process of receiving questions right now, Dr. Lee.
Our first question is from the SF Examiner. How will the city's overall response aid schools with hygienic supplies and nurses needed according to the guidelines should they bring students back?
I'm sorry, can you repeat that question?
Yes. How will the city's overall response aid schools with hygienic supplies and nurses needed according to the guidelines should they bring students back?
Okay, so again, we are relying on the schools to communicate what they need to open in person and the resources that they need. So it's hard for us to speak for the schools in terms of the support that they need, but certainly we are committed to supporting our schools.
Thank you. Our next question, if Dr. Feng, if you could please respond to this one in Chinese. Can you tell us a little bit more about what kind of extracurricular activities are allowed at this point?
Actually, Dr. Feng can explain it, and I can also support in Chinese too. Dr. Feng, please unmute. Dr. Feng, please unmute.
The host has muted all participants. Okay, I'm ready.
Oh, here.
Okay, thank you. So yes, I'm Dr. Richard Feng. I'm one of the physicians on the Department of Public Health, and the question is related to extracurricular activities. So, so this is an important question, and this is something that all schools are trying to figure out right now. We're trying to rely on the science available and trying to figure out which extracurricular activities are safe and which ones are not as safe to do at the moment. We are able to draw upon our experience from summer camps and childcares to inform this decision. It's difficult to try to categorize specific activities, but I think in general I can speak to general principles that we've been applying to whether to consider extracurriculars as something that is safe or not. So in general, activities that can be performed outdoors are, for example, like outdoor exercising, outdoor drills, for example, would be considered safer than activities that are performed indoors. In addition, all activities would be safer if they can maintain social distancing. So in general, activities that involve close contact, touching, are less safe. And so it is very possible that activities that we do allow will have to be modified to adhere to principles of social distancing. They should be performed outdoors as possible. If possible, they should be performed by within the cohort so as to prevent large gatherings of people.
Great, Dr. Feng, I will translate into Cantonese. 咁剛才咧，馮展雄醫生咧就係我哋 UCSF 嘅心理科醫生嚟嘅。佢剛才講到咧，而家有關我哋呢個repeat。So 有關頭先馮醫生講咧，就係話我哋而家要睇下我哋嘅數據啦，要睇下邊啲活動係較為安全，同埋邊啲活動係冇咁安全嘅。咁呢啲要睇我哋嘅科學同埋醫學嘅數據。咁所以咧喺我哋而家開始咧，就會睇下我哋夏令營咧同埋托兒所佢哋嗰個傳染率或者染病率嘅。咁咧就講到我哋有關啲唔同嘅種類咧，就要睇下個活動是否係室內啊，或者係室外嘅活動嘅。咁按照我哋基本嗰個原則咧，一般嚟講咧係室外或者戶外嘅活動咧，喺呢個空曠嘅位置咧係比較安全啦。咁同埋咧就講到我哋一定要保持一個社交距離嘅。為我哋學生嘅安全，室內活動咧，因為佢嗰個空氣流通冇咁好咧，可能係比較冇咁安全。咁所以我哋頭先馮醫生講咧，都係鼓勵多啲室外嘅活動。咁同埋咧就係有關我哋啲學生嘅小組咧，英文叫做 cohort。咁即係話我哋希望咧就可以留翻喺自己一個小組嗰度，減低我哋學生同其他嘅班次或者其他嘅小組咧互相接觸，咁咧就可以減低我哋嗰個傳染率。咁但係我哋都講到咧，因為小童咧怕有呢個窒息咧，所以要睇下情況，睇佢幾時適合戴呢個面罩或者口罩嘅。
And Dr. Lee would also like to respond to that question. So Dr. Lee, if you'd like to provide additional information.
Yes, so to echo what Dr. Feng said, that we have certain principles that we've used in our guidance on extracurricular activities. And the ones that, the specifics we can say is that chorus is a very high risk activity because it involves the production of respiratory droplets. And we've seen that, that a large group of adults was infected with COVID-19 during a group singing practice. So we are recommending against chorus, and for the same reason against wind instruments such as woodwinds and brass. Other instruments like percussion and string instruments that don't involve the production of respiratory droplets are okay. A lot of people have questions about competitive sports, and I think it's safe to say that at this point in time, we are not recommending sports that involve people being within 6 feet of each other.
In Spanish. Sorry.
And because of the emphasis on keeping people in cohorts, in stable groups, and keeping groups from mixing, we're probably not going to recommend interscholastic competitions in the near future.
Great. Let me provide a translation in Cantonese, and Leo will also summarize in Spanish for our press. 剛才咧，李醫生講咧，就話關乎到我哋傳染咧，就係喺音樂堂咧，用呢啲譬如歌唱或者呢個唱歌班咧，因為佢會有呢個呼吸咧，同埋呢個噴沫咧出去咧，所以都係唔鼓勵呢個 chorus 嗰個唱歌班嘅。咁第二咧就係有關用呢個音樂啦，即係 musical instrument 咧，因為佢亦都會有傳播或者傳染呢個噴沫，可能會帶菌嘅，所以暫時嚟講咧喺我哋嘅指引咧都唔鼓勵呢個音樂堂。第三咧就係關於 intercollegiate sports 或者 interscholastic sports 咧，即係嗰啲比賽嚟講咧，因為有身體嘅接觸或者有嗰個我哋用嗰個波球 或者一啲身體嘅接觸，都可能會有呢個傳播。所以喺嗰方面咧，我哋暫時嚟講咧，按照嘅指引都係唔鼓勵呢啲嘅。And I'll pass it on to Leo.
En este momento están tomando la evidencia que tenemos con programas extracurriculares de la escuela, como el coro, donde cuando cantan los estudiantes pueden pasar el virus con la saliva. Entonces eso es algo que ahorita están evitando para que no se siga propagando el virus entre los estudiantes. Igual con los instrumentos y banda, porque cuando usan los instrumentos como trompetas o como clarinetes, también se está usando saliva para que puedan producir el sonido. En este momento también estamos evitando competencias entre escuelas, porque es cuando los estudiantes están mezclando con otras escuelas y estamos tratando de evitar que eso siga propagando el virus.
Thank you, Leo. And Dr. Lee, we also have a request to repeat the portion where you spoke about competitive sports as the audio got interrupted.
I'm sorry? The audio got interrupted on the competitive sports?
Yes, so if you could repeat the portion where you discuss competitive sports.
Okay, so competitive sports have certain specific risk factors. And the main one is that you're allowing cohorts of different students to mix, and that promotes the spread of infection. So our rules are that people shouldn't be doing active exercise within 6 feet of each other, because again, the deep inhalation and deep exhalation may be an increased risk for infection. And also, we don't want competitive sports happening between different cohorts of students. And so that's why we're unlikely to recommend interscholastic sports for those sports that require students to be within 6 feet of each other in the near future.
Thank you, Dr. Lee, and Leo will be translating that into Spanish.
En este momento estamos evitando las competencias entre escuelas. La razón es que estamos evitando la mezcla de diferentes estudiantes de diferentes escuelas. También en eso hay mucho ejercicio que se está haciendo en esas competencias y estamos tratando de que sigamos el distanciamiento social, perdón, porque cuando uno está haciendo ejercicio está respirando fuerte y es donde se pueden desparramar el virus con otros estudiantes de diferentes escuelas.
Thank you, Leo. An additional question for Dr. Lee from the SF Examiner. How many hours of the school day are these ongoing precautions anticipated to take up?
That depends on how the schools implement them. So it's very hard to say because so much depends on how the schools are going to operationalize them.
Thank you, Dr. Lee. That is all the questions that we have received in English. Dr. Catherine James will be joining us at 2 o'clock to speak in Spanish. So if you would like to stay on the line and wait for Dr. James, then she will be here in approximately 10 minutes. And thank you very much, Dr. Lee, for speaking today and taking questions, and also to Victor and Leo for translating so far.
And in the interim, if we have other outlets that wish to have anything addition in Chinese until Dr. James joins, please submit your questions on the chat, and we are happy to have Dr. Feng answer any questions, and I will translate.
And Dr. Lee, we just received one more question. The question is, if a student lives with high-risk people, will the student be required to physically attend school?
Again, that is going to be a decision for the schools to make in their in how they operationalize this guidance. The only thing we say about students and medical conditions is that the school should not automatically exclude a student because they have diabetes, asthma, or another medical condition, that they should allow the student's medical care team and family decide whether in-person attendance would be indicated. Beyond that, we leave it to the schools.
Thank you, Dr. Lee. And it looks like we have a couple more questions coming in. So Mel Baker with the San Francisco Public Press, is there a timeline in which the city and SFUSD will decide if it is safe to reopen based on the number of cases? Is there a date in which the Department of Public Health will make a final decision on the nature of schools opening?
We don't have a timeline, and a lot will depend on what we see with community transmission in the coming weeks. And again, the decision DPH will make is whether it is safe for schools to reopen with these recommended interventions in place. The decision for specific schools or specific school systems to reopen to in-person attendance is going to probably be based on other factors like, do they have the resources to implement these interventions? When will those resources be available? But it's two separate sets of decisions. I hope that makes sense.
Thank you, Dr. Lee. Our next question is from Kathy Novak, at KCBS. And the question is, what preparations teachers should be making, and if those preparations will differ depending on the ages of the students they're teaching?
So I just want to say that we put a lot on our teachers, and it's not really on individual teachers to make preparations for the schools to be safe. I think that is on the school systems or the school administrations themselves, because it really has to be a coordinated, layered a set of interventions at the school level. And that is beyond the power of a single teacher to make it safe because of the multiple interventions that need to be implemented. So that would be my main message.
Thank you, Dr. Lee. And we have a request for a translation to Chinese, so Victor will be translating your response for us.
Do you mind reading the question?
Yes, so the question again is what preparations teachers should be making, and if those preparations will differ depending on the ages of the students they're teaching.
好嘅，咁頭先剛才咧有一個問題咧係有關我哋三藩市聯合校區同埋學校咧，我哋睇下啲先生咧或者啲老師咧需要做啲咩預備嘅工作，咁同埋咧佢哋嘅教育方針咧係同唔同歲數係要做啲乜嘢嘅。咁呢樣咧就係要按照睇下同校區繼續商討，同埋我哋呢個衛生局嘅，因為咧每個老師咧佢哋可能個對象或者學生咧都係唔同啦，咁就要我哋再探討一下咧，譬如佢嗰個班次啊，或者佢哋嘅人數啊，或者嗰啲安全嘅指引咧，我哋都係要再相關去探討一下嘅。
And Dr. Lee, I understand that you have further information you'd like to provide. If you'd like to do that, and then Victor can provide translation. Thank you.
So in terms of different interventions at the school level for different age groups, they will differ. For example, we know that for our very youngest children, physical distancing for the entire day is very tough, not practical for socio-emotional learning. And just very difficult to enforce for an entire school day. We also know that our youngest students are probably the lowest risk for COVID-19 infection and the lowest risk group to spread it. So for that group, our guidance says that we want to prioritize stable cohorts as well as universal masking at this age, so universal face coverings. For our older students who are more able to physically distance, for whom that's a more realistic expectation, then we would emphasize that. We'll emphasize, and then by emphasizing that, that allows for a little more overlap in cohorts safely. And again, at this age, we want to continue to emphasize the universal face coverings for everybody as much as possible. We do recognize that the risks to staff and teachers are going to vary a bit by age, and probably the teachers of our youngest students are going to be at the lowest risk of being infected by their students versus our high school teachers. But we also know that the risk of adult-to-adult transmission probably trumps all of that. That based on what we see locally and nationally in other settings with children, that adults are more likely to be the ones in schools who have the confirmed COVID-19 case, and adult-to-adult transmission, staff-to-staff transmission has been more likely than child-to-staff transmission. So at all of these ages, we are really trying to focus on preventing staff-to-staff transmission and spread between staff at any given school. And that's emphasized in our guidance.
Thank you, Dr. Lee。我用廣東話翻譯一下。咁剛才咧，李醫生講到咧，就係呢個身心健康對我哋啲小學生咧，如果要長期社交距離咧，係比較難嘅。咁但係因為我哋見到而家嘅數據，小學生或者年齡比較細嘅同學咧，佢哋嗰個染病率同埋傳播咧，都係較為低嘅。按照我啲數據，所以喺現時情況咧，我哋係鼓勵佢哋要有呢個強制性嘅戴面罩或者掩蓋呢個口鼻啦。同埋咧就佢哋嘅小製班次咧，就希望佢哋唔會同其他嘅班咧有接觸或者撈埋啲其他學生嗰度。咁如果講到中學生或者高中生咧，佢哋嗰個傳播率或者傳病嗰個可能性咧，就較為高啲。按照我哋而家見到個數據，咁但係最關鍵咧唔係話呢個學生同老師嗰度，係由老師同老師、大人與大人之間。嗰個傳播率咧係比較我哋擔心咧，所以我哋而家希望可以同校區咧作出即係 teacher to teacher 老師至老師之間點樣防止呢個新冠肺炎嘅傳播嘅。咁同埋咧，如果喺高啲嘅班次咧，我哋可以可能有多少少嘅接觸，但係佢亦都可以佢哋係需要遵守呢個社交距離啦、勤洗手啦，同埋呢個戴面罩嘅。And then at this point, I will also let Leo say it in Spanish.
En este momento hemos visto que las intervenciones sí van a ser diferentes en las diferentes edades de los estudiantes. Los niños más pequeños sería muy difícil tratar de practicar el distanciamiento social por el efecto que va a tomar en las emociones de los niños. Y sería muy difícil porque, bueno, los niños necesitan ese tipo de instrucción. Pero también sabemos que los niños más jóvenes tienen menos riesgo de infectarse con el virus y también tienen menos riesgo en pasárselo a un adulto. Con este grupo tendríamos un grupo más estable y también estaríamos recomendando las mascarillas o el cubrebocas universal. En los estudiantes más grandes también tenemos que ser un poquito más selectivos con los grupos que se están mezclando. También es menos riesgo que estos estudiantes le pasen el virus a los maestros. El problema que estamos viendo o que queremos evitar es la propagación del virus entre los maestros, porque es más contagioso de adulto a adulto que los muchachos más jóvenes a los adultos. También estamos practicando las mascarillas o cubrebocas universal para tratar de evitar la propagación del virus en estos grupos. El enfoque sería que prevengamos el contagio de personal de la escuela o los maestros a otros maestros de la escuela.
Next question is from Crystal Liang from Skylink TV. Will all teachers be tested before physically going back to school, or did you recommend such a measure for the teachers? And request for a Chinese response. So either Dr. Feng or Dr. Li can take the question. Thank you.
Okay, so testing is available to all SFUSD teachers and employees, regardless of whether they live in San Francisco or not, because we consider them to be essential workers and because they work for the city and county of San Francisco. The Get Tested website can tell people where to get tested. So we are not currently requiring schools to have teachers or students be tested. And that is because testing only tells you whether a person is infected at a certain point in time. They could have a negative test and the next day be infected. So unless a school system is willing to do something similar to what we've done in our nursing homes and long-term care facilities, where we're going in and testing everybody every several weeks, that it's not thought to be as useful an intervention. That said, we absolutely want to make sure that our school staff and teachers have access to testing and can get tested if they would like to, whether or not they have symptoms.
Thank you, Dr. Lee. 咁剛才李醫生講到咧，就話喺有關老師或者先生喺我哋聯合校區，甚至乎喺我哋三藩市咧，全部咧都係屬於我哋機要嘅工作人員啦。所以咧，佢哋可以同我哋市府嘅 Get Tested SF 嗰度咧去登記做呢個檢測，睇下有冇新冠肺炎嘅。咁但係目前嘅指引咧係冇要求我哋所有先生或者老師咧強制性去做呢個檢測嘅，因為嗰個檢測咧只能夠話俾你聽喺佢當時檢測嗰日嗰個時間是否呈陰性或者陽性。咁可能佢今日係冇病嘅，但係聽日咧佢可能就得病或者染病。咁所以咧呢一方面咧，我哋當然如果老師認為係需要做嘅，我哋鼓勵佢哋做，但係暫且咧係未有一個強制嘅要求嘅。
En este momento, la prueba está disponible a todos los trabajadores esenciales, aunque vivan en San Francisco o no. Son considerados empleados de la ciudad, entonces sí sí pueden ir a tomar la prueba si es que sienten que lo necesitan. Pueden entrar al sitio de web Get Tested para hacer una cita o ver dónde están disponibles las pruebas. Ahorita no es recomendación o no es requisito porque la prueba nomás enseña ese momento si la persona está infectada con el virus. Entonces, el día siguiente de hacerse la prueba se pueden infectar. Pero sí queremos hacer un énfasis que los maestros de la escuela tienen acceso a tomarse la prueba si tienen síntomas o no.
Well, at this point, I think Dr. James might be wrapping up her meeting. Are there any final words that Dr. Lee or Dr. Feng would like to chime in? Oh, Dr. James just joined. We will have to unmute. Dr. James, welcome. Thank you for joining us.
Sure. Thanks for having me.
Yeah, we've actually answered a lot of questions already. But is there anything in particular you would like to present to our Spanish-speaking community, Latinx community, directly in Spanish? You have the floor. Thank you.
I think we were just talking about schools reopening and where we are right now, our current state of infections in the city. Do you want me to go ahead in Spanish then?
Yes, please
okay.
Go ahead in Spanish. Thank you.
Okay, muy buenas tardes. Soy la doctora Catherine James, mucho gusto. Hoy estamos para ponernos al día con donde estamos ahora en nuestra ciudad en cuanto a reabrir más negocios y más actividades y últimamente las escuelas, ¿verdad? Entonces han escuchado a lo mejor que en este momento los casos en California y también en el área de la Bahía y en San Francisco están subiendo. Por lo tanto, ayer la alcaldesa y el director de salud público anunciaron que no vamos a seguir avanzando por el momento. No vamos a poder abrir los bares afuera ni tampoco restaurantes para comer adentro. Tenemos que aguantarnos donde estamos. ¿Por qué? Porque los casos han venido subiendo. Hace 3 semanas anotamos 172 casos en la semana. Hace 2 semanas aumentaron a 278 y en la semana pasada 402. Así que los casos van subiendo y por eso lo más seguro es aguantarnos y no reabrir más actividades para nuestro público en este momento. También entonces seguimos viendo cada semana cómo estamos. Lo positivo es que estamos realizando muchas pruebas. Estamos en un promedio de 1,700 semanales de pruebas de coronavirus en San Francisco, lo cual nos permite detectar enseguida nuevos casos y seguir los contactos, ¿verdad? Para poder controlar mejor en la comunidad. Pero en este momento no está controlado, el virus está circulando bastante aún más y por eso siempre tenemos que regresar a las medidas que bien conocemos, las 3 M's, ¿verdad? Que es la máscara, cubrir la boca y la nariz en público, las manos, lavarnos las manos cada vez que tocamos algo y no tocar la cara. Y también mantener la distancia, los 6 pies o 2 metros entre personas. Entonces, siempre tomando estas medidas, podemos seguir viendo cómo prevenir más contagio en nuestra comunidad, ¿no? Que esa es la meta. La otra cosa que estaba hablando la doctora Lee, la pediatra que está en la llamada hoy, es los pasos que están tomando para poder reabrir las escuelas y que han hecho conjuntamente con los líderes del distrito de San Francisco, las escuelas privadas, independientes y católicas, un plan de poder ir preparando las escuelas para poder reabrir cuando es seguro de hacerlo, ¿verdad? Porque en este momento todavía, como hemos visto, los casos van subiendo y en este momento todavía no estamos preparados para reabrir. Pero como dijo la doctora, las escuelas, los distritos están haciendo los preparativos necesarios para cuando haya menos virus circulando en la comunidad, sea posible reabrir las escuelas. ¿Qué otra cosa queremos conversar hoy día? ¿Hay algo más?
En este momento queremos dar la oportunidad de que nos contesten las preguntas en español. Si tienen una pregunta, por favor, mándenla por el Zoom para que la doctora James nos pueda contestar.
Well, if we have no other questions from our press, we want to thank all our press partners, and we want to thank all our doctors from DPH for being here today. Thank you very much. I hope that you had an opportunity to record, and we'll be sending out the link very soon. I'll repeat in Chinese. 多謝我哋今日所有嘅傳媒啦，多謝我哋中文傳媒今日咧就參與我哋呢個記者會。咁希望咧你哋今日得到你哋嘅答案，咁同埋咧我哋陣間會 send 翻個 link 俾大家有關呢個錄影嘅。
Muchísimas gracias por estar con nosotros ahora. Agarramos mucha información y vamos a repartir el link de esta grabación, aunque también le dimos la oportunidad de grabar esta conferencia. Muchísimas gracias por estar con nosotros.
Thank you, everyone. Have a great day. Thank you.
Thank you.
Bye-bye.